So next up we have chapter 11 for dental images and the dental radiographer. This is also a pretty short chapter, so it should go pretty quick. By the end of this chapter, you should be able to define the key terms associated with dental images, discuss the importance of dental images, list the use of dental images, discuss the benefits of dental images, list examples of common dental conditions that may be evident on a dental image, discuss the knowledge and skill requirements of the dental radiographer. You should be able to list the duties and responsibilities that may be assigned to a dental radiographer and discuss the professional goals of the dental radiographer. All right, and so the purpose of this chapter is to review the importance and benefits of dental images and the knowledge and skill requirements that the dental radiographer needs to have, to define the role of the dental radiographer and describe his or her duties and responsibilities, and we need to outline the professional goals of the dental radiographer. All right, so we're going to be taking dental images, and a dental image is a photographic image produced on film by the passage of x-rays through teeth and supporting structures. This is a two-dimensional representation of a three-dimensional object. Dental images are a necessary component of comprehensive patient care. And the importance of dental images. They are a necessary component of comprehensive care. They are essential for diagnostic purposes. They enable the dental professional to identify many conditions that might otherwise go undetected, and they provide a great deal of information about teeth and supporting bone structures, more so than we could ever write in our clinical notes. Our dental images provide so much more of that information. An oral exam limits the practitioner to a knowledge of what is seen only clinically, but the radiographs allow us to see what we can't see with just our eyes. Like we said in the beginning of this, in the book, I think it's chapter 1, the use of dental images is to detect diseases, lesions, and conditions of the teeth and bones that cannot be identified clinically. We can also use them to confirm suspected diseases. Maybe we see a bump and then we take a radiograph and we see, okay, this is actually a periapical abscess. They assist in the localization of lesions and foreign objects. They are an essential component of the patient record, and we can use follow-up images, comparing them to our initial images, and we can see what changes have happened since we last saw the patient. For instance, the first time we see a patient, we might take radiographs and see radiographic calculus, and then the second time, after their SCRP cleaning, we might go back and take x-rays again, post-op bitewings, and see that radiographic calculus has been removed. And so we would be able to compare the two x-rays, radiographs against one another. Subsequent images are used for that comparative purposes. These next few slides, these are just CBCT scans that are taken of the teeth and structures that I guess the book thinks is really cool to look at. So there's this one. There is this one. This like yellow portion, this shows the mandibular canal. You can also see this giant radiolucency right here. This is it's some type of cyst that is underneath this structure. We'll get into this more when we get into the structures that we're looking at, but this is certainly cause for concern. This is another CBCT scan. This yellow sort of piping here, this is the mandibular canal on the one side, and then you can see this purple piping on the other side. That's the mandibular canal on the opposite side. Same thing here, we're just seeing the opposite side of it. We're able to see this this tooth right here. This is the wisdom tooth that's here, and then you can see this sort of pinkish lesion. This is the area where the CBCT scan has actually filled in where that cyst is, and they're going to be able to use this image in order to remove that cyst properly. The benefits of dental images. The primary benefit is the detection of disease. It is always the primary benefit is the detection of disease. We want to be able to detect disease before it causes a problem for our patients, and we want to be able to catch it soon enough that we're able to correct the problem before it becomes something that we can no longer reverse. The benefit of detecting that disease far outweighs the risk of those small doses of X radiation when we are taking our radiographs properly. The use assists the dental professional in identifying and preventing problems such as tooth-related pain or the need for surgical procedures. So if we were to take radiographs and see, the beginnings of bone loss, and we were to see radiographic calculus, we would be able to inform our patients that they have the need for a deeper cleaning, and then we would provide that for them before they end up having severe periodontal disease and before they begin to have mobility in their teeth. And so the radiographs really provide a very important foundation of knowledge so that we can use it in order to prevent further problems. Dental images can minimize and prevent those future problems. The information that we find on dental images include whether teeth are missing, whether patients have extra teeth or supernumerary teeth, whether the patient's teeth are impacted, meaning they will not be able to grow in. Uh, they're never going to grow in. They could have dental caries, which are cavities. They could have periodontal disease, which is loss of the bone supporting the teeth. They could have tooth abnormalities. Maybe the patient has fused teeth. You guys are going to be getting into those a lot when you're in your dental anatomy class, but there's a lot of wonderful, really, really cool tooth abnormalities you guys are going to learn about. Retained roots. Maybe the patient had a extracted tooth, but one of the roots broke off, or maybe the patient just broke one of their teeth and the root is retained inside the bone. And then cysts or tumors, which we just saw in those last X-rays. The cyst or the tumor that is encompassing around that tooth. My guess is it's either an ameloblastoma or a dentigerous cyst, but I'm not a dentist, so who knows. The dental radiographer needs to have the knowledge and the skill requirements, the duties and responsibilities, and professional goals. We need to know each of these in order to be a proper dental radiographer. So, like we learned in the first chapter, the dental radiographer is any individual who positions, exposes, and processes dental x ray film. Typically, in an office, it's a dental auxiliary, which means either the hygienist or the assistant is the one taking these radiographs. The knowledge and skill requirement in order to take radiographs is a basic understanding of radiation history, which we found in Chapter 1, a working knowledge of radiation physics, characteristics, biology, and protection, which we've learned about, the familiar characteristics of dental x-ray equipment, film, image characteristics, processing, and quality assurance, which we just did, and then patient management basics, which we're going to get into in the next chapter, and then technique, concepts, and technical skills, which we will probably be talking about for the rest of the time that you are in my class, but also the rest of the time that you are in this program. We're going to be working on technique, concepts, and technical skills. The duties for the radiographer include the positioning and exposure of dental x-ray films, processing of dental x-ray films, mounting and identification of dental x-ray films. So, if you're running all of those x-rays through the automatic processor and you get, just this collection of films, you need to be able to make sure you are orienting them correctly within the mount, so that your dentist or whomever it is that needs to look at those radiographs is able to view them in the position that they are supposed to be in. We're going to use them to educate our patients, not only on what we are seeing on the radiographs, but also how radiographs help our patients to be able to detect disease before we are able to see it clinically. The maintenance of darkroom facilities and processing equipment, we need to understand and to be able to do these things, because if you go to an office where they have a dark room or they're using processing equipment like that, you're not going to want to be lost. The implementation and monitoring of quality control procedures. So taking those tests and things like that, you're going to need to be able to perform those tests. And ordering of film and supplies. This is something that not every office does, as far as whether the hygienist does it or the assistants do it. But making sure that you're ordering the right types of film and the right types of supplies for the equipment that you have in your office. So our professional goals as dental radiographers need to be in protecting our patients from radiation. We need to protect the operator from radiation, protect ourselves. We need to be able to educate the patient on the pros and cons of having X radiation. And then the operator competence. We need to be competent in what we are doing. We need to know what we're doing. We need to understand why we're doing the things we are. We need to be efficient in our jobs. Every patient who gets radiographs knows that they just want to get it done. You don't want to spend all day doing that. And so when you're good at your job and you're doing it quickly, patients really appreciate that. the production of high quality images, because you don't want to, you want to minimize those retakes by taking high quality images, by getting those diagnostic images is how we're going to minimize those retakes. And then high quality care. If we are doing every single thing within our power in order to perform all of these other things, we're performing high quality care. You don't even have to worry about that one. Wasn't that nice? It was nice and short. So anyway, if you have questions, you can put them in the question and answer. If you can send me an email or you can ask me in person. Totally up to you. Just make sure you at least look through this chapter.